Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name, please? Nice to meet you, Mr. Sam. May I know what brings you here today? Okay. Tell me more. I'm very sorry to hear about that, Mr. Sam, and I understand your worries. But to better understand your condition, I need to ask you a few questions. Is it okay with you? Thanks for your cooperation, Mr. Sam. So, Mr. Sam, can you tell me since how long you're suffering from such kind of discharge? Okay. I know the color of discharge. It's yellowish in color. Okay. Have you noticed any itching along with that? Okay. Any burning while passing? Okay. If there is any associated urinary frequency, a pain while passing urine. Okay. All right. So, Mr. Sam, and do you have a fever along with that? With chills? How about your appetite? Okay. All right. Mr. Sami, so if there is any sore throat, pain while swallowing, how do you feel all the day? Okay, if there is any malaise. Okay, have you noticed any unusual bleeding or spotting? Okay, may I know the color of your urine? Have you noticed any blood in urine? Any abdominal discomfort? Any flu-like symptoms? Do you have runny nose? Have you noticed bleeding from gums? Any visual problem? Blurring of vision? Any rash? Any lesion or rash around your private parts? All right, Mr. Sam. If you are married, and you have children, all right. So, Mr. Sam, have you traveled recently? Okay. I'll ask you a few personal questions to better understand. Is it okay with you? Thanks for your cooperation, Mr. Sam. And so, Mr. Sam, do you have extramarital affairs? Okay. All right. So, if you had any antibiotic treatment for that, have you noticed any testicular pain along with that? If you used any barrier? Okay, Mr. Sam, do you have any history of injecting drugs? If you are a smoker? Okay, how much cigarettes you use per day? Since how long? Have you ever tried to quit this habit? All right, Mr. Sam, we'll talk in detail in this next appointment. How it sounds to you? Okay. And Mr. Sam, do you drink alcohol? Okay. Do you have high blood pressure? High blood sugar? If you are taking any medication prescribed by doctor or over the counter? How about your partner? How's her condition? Okay. Okay, if she has also some complaints. All right. Okay, so Mr. Sam, how about your sleep pattern? What do you do for living? Okay. All right, Mr. Sam, in order to reach my diagnosis, I need to examine you. How it sounds to you? Thanks for your cooperation, Mr. Sam. And I'll sanitize my hands. Mr. Sam, can you please come on the couch? And then I'll start from general physical examination. I'll glance at patient's face, if it is toxic or pale, if there is any rash, any redness of eyes, any spider nevi, and then I'll ask if look up, look down, show me tip of your tongue, and then I'll examine his lymph nodes, cervical lymph nodes, and supraclavicular lymph nodes, and then I'll palpate thyroid and ask patient if he has any pain, if it is tender, and then I'll check his skin texture, pulmonary edema, skin, if there are any warts, if there is any ulcer, and there's nails, and then okay, Mr. Sam, I need to examine your private part. Okay, we have to say in OSCE. That's how maybe our examiner will show us the result of DRE. So we need to say that I need to examine you. I need to do a digital rectal examination. By saying that, we will be given the findings of DRE. So maybe there will be prostatitis. So we will narrow a diagnosis. Okay. So it's like that by saying that, and then shins for any edema, any rash distribution. Thanks for your cooperation, Mr. Sam. You can have your seat, and then again I'll sanitize my hands. Okay, Mr. Sam. So I need to order a few investigation to confirm my diagnosis. Okay. And that is a mid-urine sample. Okay, you have to catch a urine sample. Okay, for nucleic acid amplification test. Okay, and along with that, ordering complete blood count, hepatitis B profile, okay, heavy surface antigen, HIV 1 and 2 serology, and VDRL. Okay, how it sounds to you, Mr. Sam? But before I offer, let me confirm, have you undergone any investigation so far? All right, Mr. Sam. And so the history you have shared, the question I have asked, and the examination I have performed, okay, and your digital rectal examination, if there is prostatitis, okay, and so I came to the conclusion that most probably you are suffering from a condition what we call in our medical terminology is gonorrhea. Okay, as you stated that you had unprotected intercourse. Okay, so it's common in sexually active. Okay, so to confirm a diagnosis, I need to offer these investigations. Okay, and along with that, I'll and tell you some safety nettings and pharmacological management as well. Okay, so I'll encourage you to use protective measures. Okay, use condoms. Okay, and I'll strongly recommend you to restrict the number of partners. Okay, I'll encourage you to have monogamous relation. Okay, and along with that, I'm offering you to get vaccinated against such infections like hepatitis A and B, okay, and human papilloma virus, okay, and Besides that, I'm offering you injection ceftraxone 1 gram IM estate. How it sounds to you, Mr. Sam? All right, Mr. Sam. So, and capsule azithromycin 1 gram per oral estate. Okay, and along with that, I'm prescribing tablet paracetamol 500 mg. You have to take it 3 times a day. Okay, for your generalized body ache. Okay, how it sounds to you? Is everything clear till now? Should I summarize it again for you? Okay, Mr. Sam. And so here is a leaflet. It includes all the information regarding your condition. I hope it will be helpful for you. Okay, take good care of yourself. And I'm scheduling your follow-up, okay, to ensure you are recovering well, okay. And so after 14 days, how it sounds to you? Or is it convenient for you? Okay, Mr. Sam. So I'll see you after 14 days. Take good care of yourself. And when labs are ready, let me know. Okay, you can communicate with me anytime. Okay, bye bye.